Hello there and welcome to today's video. I'm going to be answering the question, can people with tics drive? This is not a simple yes or no answer because it's different for everybody. Some people will have tics that affect their ability to drive and other people will find that their tics do not affect their ability to drive. So it isn't a simple answer. But certain tics can really affect someone's ability to drive. For example, blinking tics. Even though blinking tics are seen as a simple tic, they can actually have a huge impact on someone's ability to drive, because if someone keeps blinking, then they are not going to be able to see properly, because obviously when we blink hard, our vision goes for a second, and that can be really dangerous while driving because someone could pull out in front of you or something like that. Other people may have leg tics, where they may jerk their leg and accidentally hit the brake, and that could be really dangerous because someone could come and crash into the end of your car. Some people have impulsive tics, where they just may suddenly swerve or may suddenly toot the horn or something like that, or press random buttons on their dashboard, and that can be really dangerous. So it can be really difficult for some people to drive when they have tics. Again, with head jerking, that can make you either move the steering wheel or take your eyes off the road for a second. There are many different tics that can affect someone's ability to drive, but tics do change all the time. So it's possible that someone can usually drive, but then they develop a tic that stops them from being able to drive, but then that tic will pass and then they can drive again, or something like that. So it isn't always constant either. It's not necessarily a constant yes you can drive or no you can't. It really depends on what tics you have at the time and how they affect you. But as well as this, many people with tics have co-occurring conditions, and the co-occurring conditions can sometimes affect someone's ability to drive as well. For example, OCD, intrusive thoughts, and mental compulsions could take up someone's focus so much that they do not have the ability to concentrate on driving. With ADHD, someone may be unable to focus on driving, or with something like sensory processing disorder or Irlen syndrome, a person may have such light sensitivity that they get distracted by lights and can't see properly, or they struggle with depth perception because their brain cannot process the light properly, and that can be harmful whilst driving. But some people with tics can actually drive fine. There are a lot of people, some people with severe tics, who actually can drive completely fine. Their tics don't necessarily affect their ability to drive, and this can be that for some people concentrating reduces their tics, and when you drive you do concentrate a lot usually. Some people find that when they are driving they can sort of feel the urge to tic coming on, so they can pull over and then like have their tic episode, and then when it's calmed they can set off again. I've heard of some people doing that. It's important to know that when you apply for a driving license, you do have to tell the DVLA about your condition that causes tics. So if you have Tourette's, you'll have to tell them about your Tourette's if it will affect your ability to drive. If you have Tourette Syndrome and it can affect your ability to drive and you do not tell the DVLA, then you could be fined up to £1,000. So it usually is best to tell them. Knowing this sort of thing can actually help people seek a formal diagnosis, because some people may not feel that a formal diagnosis is necessary, but then they realise that they'll probably have to provide the information about their condition to the DVLA and have an explanation as to why they tic. So that might help people seek a formal diagnosis of something. It can also help to tell your insurance company as well. You do have to tell them, because if you get into an accident because of your condition and you didn't tell them, then the insurance may be invalid. But telling them about your condition doesn't necessarily mean that your insurance will be more expensive. So it is good to tell them. People who have less of a premonitory urge before they tic may find it harder to drive, because a premonitory urge is a sort of feeling we get before we tic. And if people get that, then they have a sort of warning before they tic. So if they can physically feel bad episodes of tics coming, then they can pull over. But if someone doesn't have a warning and they just suddenly tic and do something that affects their driving, then that's an issue, because they can't really do anything to redirect it or pause for a moment. So for those who don't feel as much of an urge, it can also be really, really difficult. Some people might find that they can use methods to reduce their tics while driving. So some people might wear sunglasses, some people might listen to music in the background if that calms them. So there are some things that can help people with tics feel more calm when driving, which may in turn reduce the tics. There are medications that may be used to manage tics that could also affect someone's ability to drive due to side effects of tiredness and drowsiness. So again, it is really important to tell the DVLA if you are on a medication that can cause drowsiness and therefore may affect your ability to drive. It's also really important to talk to your doctor about it and ask them if they think that it's good for you to drive or not because of your tics or the medication. It can sometimes be worrying for people with tics and parents of people with tics when it comes to thinking about whether the person can drive or not, because sometimes it's very uncertain because you don't know what's going to happen once someone is out on the road driving. So it can be a difficult decision to make as to whether someone should go for driving lessons or not. When someone is in a driving lesson, it is helpful to tell the instructor if you have tics, just so that they know what to look out for. So they know why you're making noises or certain movements and things like that. It is helpful to tell them. In the theory test, it is possible that you could get accommodation and support if you have a disability that may affect your ability to take the theory test. Some people with tics are so good at driving that they are racing car drivers or they are ambulance drivers. But even if you can't drive because of your tics, it's okay because there are a lot of other modes of transportation, like public transport, buses, or carpooling with someone else. If you have a friend or a partner who can offer to drive you places, that can be very helpful. Just because your tics stop you from driving right now doesn't mean that you'll never be able to drive, because tics can change all the time and it is possible for them to reduce, especially if you find some sort of management strategy. It can be strange seeing all your friends getting driving licenses in cars and then you can't, but remember that it's not your fault, and you're not less of an adult because of that. You just have a condition which happens to affect your ability to drive. There are actually a lot of people who have conditions that affect their ability to drive, so you're definitely not the only one.